Let me take a selfie.
They can be silly, sexy, or sentimental. The selfie can capture the moment just right or highlight exactly what you don't like about your face. The wrong angle can be your worst enemy.
A selfie completely alters the way we see ourselves depending on the position of the camera. So if you hold the camera high up in the air, the lower third of the face looks smaller and the upper third of the face looks bigger. And that's actually an attractive look for women.
And who doesn't want to look attractive, right? Take 25-year-old Lisa Earhart from San Carlos.
I guess maybe I'm vain. I love looking at myself.
She takes dozens of selfies a day, spending anywhere from 5 seconds to 30 minutes to get the perfect pic.
I save all of them, first of all. Every single selfie gets saved.
She takes so many selfies, even her dogs know how to strike a pose.
Take a selfie.
The craze has swept social media for years, with Kim Kardashian and even President Obama snapping pics on the go. Selfie was first uttered in 2002, and in 2013, the Oxford English Dictionary called it the word of the year, after its use skyrocketed by 17,000% in just 12 months.
When you see the President of the United States taking a selfie with world leaders at a conference, then you know this is a universal phenomenon and it's a human nature phenomenon and it's not going away.
Renowned plastic surgeon Dr. Steve Dion has logged countless hours researching the selfie phenomenon and says it truly has changed the way we see ourselves, especially with his patients.
We're not really sure what we're treating. Are we treating the person's image in a selfie, the person's image in a mirror, or the person in real life? Because a selfie is not a real image of ourselves.
I just don't like this side of my face. For some reason, the crook in the teeth really bothers me, and the widening of my nose, the nostrils are not quite even.
Take another look at Lisa. Think she looks like anyone famous?
Daily comments that I look like Taylor Swift.
But those compliments just aren't enough. Lisa wants to look even more like the country pop sensation and invites us to a surgery consultation.
We want to take that nose from being flat to being more triangular.
Doctors say the nose is the most common complaint, and obsessing over selfies can lead to dysmorphia, seeing yourself unlike you really appear.
We're often our own worst critic, and we wind up looking at whatever feature we think is the worst in us.
That was the case for a British teen who took hundreds of selfies each day. When he couldn't get the perfect one, he tried to kill himself. That's extreme, but doctors say the need for approval is common.
And they measure how many likes they get within the next hour, or half hour, 2 hours, whatever it may be. And if you don't get enough likes, you get disappointed.
So while the selfie trend isn't going away, there's more to life than the perfect pic.
Most attractive person in the room, the person who walks in there, everyone wants to know, is the person who has the most amount of self-confidence.
Ashley Jacobs, Fox 5 News.